Actually, in the United States, also calculated we can probably cut $800 billion a year out of healthcare costs if we normalize everybody in the United States vitamin D level to 40 above. In 8 years, we could pay half the deficit off. This is the first paper we published. Worsening severity of vitamin D is associated with increased length of stay, surgical intensive care cost, and mortality rate. So cost is the thing you want to look at as a physician. So actually, like I said, we estimated you can cut a third of the hospital cost in Alaska just by normalizing everybody's vitamin D level above 40 nanograms per milliliter. So we also came up with another thing that the vitamin D deficiency is associated with ventilator-associated pneumonia. So the lower a patient's vitamin D level is, the more likely they are to get ventilator-associated pneumonia. So you rapidly get these patients' levels up, you can avoid some of your patients getting ventilator-associated pneumonia. We know that ventilator-associated pneumonia increases hospital costs by a minimum of $40,000. So by preventing your patient from getting ventilator-associated pneumonia, you can cut $40,000 off the hospital costs. So we looked at it another way. We looked at terms of ICU costs. Those patients that had severe vitamin D deficiency, which is here, we define severe vitamin D deficiency as patients that had a vitamin D level of 13 nanograms per milliliter or less. Remember, at 13, we started having a lot of deaths at 13, so it's not enough to stimulate their T cells. So people started dying left and right when we got below 13 nanograms per milliliter. So as you see on the far right chart, those with 13 or less out of that 195 patients, the overall ICU cost was over $6 million, just for patients that had vitamin D levels less than 13. So those that had vitamin D levels in the next group, moderate vitamin D deficiency, we define that as 13 to 26. Their cost, you see, is $1.2 million. And then as it become more normal, you see when the normal vitamin D levels was defined as greater than 40, it drops down even more. So this is more severe vitamin D, you see, has become normal, the hospital costs drop. So then we add in the floor cost to the ICU cost. A floor bed at Grady costs $1,200. ICU bed costs $4,000. So we're not counting medication or any other treatment that you get just the room, just to park in the room. So we added in that those patients with severe vitamin D deficiency cost Grady over $11 million. So we're talking about out of 195 patients. Then those with moderate vitamin D deficiency, which had levels between 13 and 26, cost a little bit over $2 million. Then you see when they got normal vitamin D levels, just $115,000. So the more severe the vitamin D deficiency level, the longer they stay in the hospital, the higher the mortality rate, and the more money they cost. So basically for physicians, if you get these people's vitamin D levels up real fast, you can decrease their mortality, you can decrease the hospital costs, you can decrease the overall cost for the state, for your local government, and then for the federal government. And so as a result, over the last couple of years, we've actually gotten money back from Grady, over $80,000 a year, which is a lot of money in Grady because we were losing money up to $50 million several years ago. So with us cutting our mortality rate, cutting wound infection rate and pneumonia rate and urinary tract infection rate, we're actually receiving money back now.